Welcome. My name is Michelle Hilburn, and I am the AVP of Quality, Compliance, and Standards at Vastian. And our presentation today will focus on Vastian's way to automate the Leapfrog Hospital Survey Binder. Automate and integrate the annual survey binder into your quality management program using Vastian's application Readiness. Upload or connect evidence to support your hospital's responses to questions within the Leapfrog Hospital Survey. During today's presentation, we will meet the following learning objectives. We will analyze the negative effects of high priority safety or adverse events. We will define challenges related to using a manual paper version of the Leapfrog Hospital Survey Binder. We will identify the effect that quality leader turnover has on maintaining evidence and compliance with safety practices highlighted in the Leapfrog Hospital Survey and the Leapfrog Safety Grade. And lastly, we will demonstrate how Vastian's Readiness enables hospitals to develop and maintain an online, automated, and integrated Leapfrog Hospital Survey Binder. We will meet the learning objectives by following this agenda. First, we will introduce Vastian, explaining Media Lab by Vastian's roots in supporting labs with accreditation and quality, and our expansion to support organizational-wide quality management. We will be discussing the negative and costly effects of patient harm, identifying challenges when collecting and maintaining evidence to support your responses to the annual Leapfrog Hospital Survey using a manual paper binder. And lastly, we will demonstrate how Vastian's Readiness application supports hospitals in achieving and integrating and automating the Leapfrog Hospital Survey Binder. As I mentioned before, I have the privilege of being the AVP of Quality here at Vastian. I am a registered professional nurse by clinical background, and I've spent the last 18 years in quality leadership positions in hospitals across the United States. So I have a lot of experience in completing Leapfrog Hospital surveys and maintaining the evidence and resources needed in completing the Leapfrog Hospital Survey Binder. I am joined today by my CEO of Vastian, Tom Ormanroyd. Tom has the responsibility to lead our company's vision and to lead innovation strategy. He has a 20-year experience in healthcare where he has helped healthcare systems and hospitals improve patient care and quality outcomes and achieve long-term financial performance. And I'm also joined today by co-presenter and my colleague Leah Westover, our VP of Client Success here at Vastian. Leah is experienced in SaaS innovation and frontline healthcare insight due to her experience in hospital operations, specifically in the laboratory space, where she was a leader and educator. She drives performance in a highly regulatory environment and now helps labs and hospitals with their quality programs and performance improvement through our intuitive, client-based software. And now I'm going to turn over the presentation to my CEO, Tom.
Thanks, Michelle, and great. I appreciate everybody giving us the time today. I'll try to be brief with my section, where I'm going to really talk about who Vastian is. If you haven't heard of who we are, we'll walk through that, and then we'll talk a little bit about some of those macro challenges that are happening in quality today. So Michelle mentioned it before. Vastian actually started as a company named Media Lab. We've been around over 30 years, and our whole focus over those 30 years have been focused on quality. We started really in the lab. And if many of you certainly know the word CLIA, in 1988, that federal legislation was passed, and it really brought a significant amount of regulation to the lab environment. In fact, it really made labs probably the most regulated department of a hospital at that time. It brought significant regulation to an environment that was very paper-based, a lot of manual process, a lot of binders, and that in order to meet these regulations and standards, ultimately things had to change, and that's where we really came in as Media Lab at that time, to really digitize and automate the process of pulling all this evidence together, ensuring competency of the workforce, and making sure that workflows met those standards. And you could show your high standards when an inspector came in or when you had to show that. So over that period of time, we've been very fortunate that to expand to 8,500 sites worldwide. We're in all 50 states. We're in 60 countries, and interestingly, we're actually in all 7 continents. There is a lab on a moored boat in Antarctica that we are in. So we've really taken this very seriously on our sort of our requirement to meet and help folks meet those quality standards. We're also in 80% of the hospitals in the United States today, helping those labs and our clients meet those standards. But while doing that, we heard a lot of folks saying, hey, we have the same challenges throughout the hospital, across all the departments, all the floors. And that's why we launched Vastian in our quality solution for hospitals, focused on meeting standards of all accrediting bodies, um, obviously being able to meet standards and expectations from Leapfrog. And that's how we launched our solution, was really to meet that need and expand our mission, which was always based in quality, to that. And how we do that is we really make it simpler. So it's really important. Back in those lab days with paper and binders all over the place, this is a similar situation. We're all have a binder, we have an Excel spreadsheet, we have multiple systems that we have this information in. And our goal was to aggregate that all into one single place so that you have all of your evidence, whether it's the day of a survey or when you're doing your survey binder questions. We need to make sure that evidence is there because you have high standards, but you just need to have it available. We also want to make it faster because we want quality leaders to spend less time with the administrative and hunting people down and more time really focusing on leading indicators and proactive approaches to quality and not be spending their time, like I said, tracking people down. And then it's important that you make it yours, that you can customize it to your specific needs, whether it's an acute care hospital or a SNF or an LTAC or an ambulatory surgical center. Each one of these organizations have standards that they have to meet, and they have to customize that to their needs. So it's always been important in our solutions that you can customize it to the standards that you're trying to meet, regardless of the accrediting body or the organization you're working with. Um, as we kind of move forward, we want to talk about some macro things. None of these sort of topics are going to be surprising, but the numbers are quite staggering. When you look at some of this, obviously, clinical care is a complicated thing that everybody has one ultimate goal, which is create tremendous outcomes. But with the amount of volume and activity that's going through, that's a very difficult thing. You're talking about thousands, tens of thousands of people trying to do the right thing with a lot of moving parts. So unfortunately, this creates sometimes preventable error, preventable issues. And you can see here that 19 million people are harmed annually in US healthcare today. That was preventable. Even with scanning and double checking of medications, $25 billion of cost is still preventable through better process, better training, better competency on medication administration. And then at the bottom, obviously, this is something that many of you think about every single day when we think about these preventable safety events and hacks and hospital-acquired infections. Um, our goal is really to be about those leading indicators and to really go about preventing. When it's already happened, it's kind of difficult to prevent. You maybe can prevent the future ones, but you cannot prevent the one that already happened. So quality is all about getting ahead of the curve, and that's really our big focus. So even though these numbers are pretty scary, the great news is they are preventable. And even if we can't get rid of every single one, we believe we can make a really big impact here with better processes and systems. So with that, I'm going to turn it over to Leah, and she'll continue to the discussion on some of the challenges that we face.
Great. Thank you, Tom. And thanks for allowing me to present to the group today. So on our challenges slide here, I really wanted to talk about the reality that many hospitals face, and that's quality leader turnover. And that can happen at any time without warning. And when it does, it usually means one thing, that someone new will inherit that responsibility for your hospital's Leapfrog Hospital Survey and evidence collection to complete your next binder, likely without a roadmap to do so. It can be frustrating, and honestly, it shouldn't be that hard, in our opinion. So turnover and documentation gaps are a real issue that can derail your ability to respond quickly and accurately to data verification requests. Then on top of that, we have the issue of data silos and every department sort of hanging on to their own info, making it really tough to get that full picture. And sharing and verifying that crucial data can be tedious. I'm reading industry research showing hospital execs point really often to fragmented data as a leading reason for lower performance scores in regulatory surveys. And then on top of that, let's not forget the classic paper binder. We've all seen it. It's slow, it's messy, it keeps your team buried in paperwork instead of focused on patients. And that's really where our Readiness app comes in. It gives you a digital centralized binder that lives on, even when staff members leave. Everything is stored electronically, so you're not really hunting through files or starting from scratch each year. More importantly, it truly helps make that Leapfrog Hospital Survey completion and the binder prep more of a team sport. And everybody can contribute, have access to what they need, stay aligned. And when the hospital, when the Leapfrog help desk comes back, let's say with clarification requests, or you get picked for a verification on-site visit, you'll be ready. No scrambling, no surprises. And excited to start our first poll question here today, if you don't mind participating with us. Approximately how many years has your current quality leader worked within your specific hospital? So it looks like our answer in the lead is 1 to 5 years, and that's actually what we expected to see. These leaders have had a little time to acclimate, to understand their hospital safety culture, and really begin making an impact. They bring lots of fresh ideas in while still being pretty grounded in their processes. This level of tenure we see often correlates with the ability to drive those real sustainable improvements and results. So thank you for your participation with that. All right, let's talk a little bit about data verification, because this is where things can really get real. After submitting the Leapfrog Hospital Survey, the work really isn't over. At that point, your facility might receive a Category A or B clarification request. If something doesn't quite add up, maybe there's a contradiction between two of your answers, or maybe one of your responses just lacks enough detail. And when that happens, the clock starts ticking. As you know, you'll have 30 days to provide that clarification, or your original response could actually be removed or revised. Now think about how that feels. Is your team scrambling to track down that evidence right now from scattered systems, or asking for different folks who might know where that information is saved? Or are you calm and organized and ready to respond in just a few clicks? And what if your hospital is randomly selected for on-site verification? That's when we have the third-party team come in to validate the information you've reported. And at that point, the stakes really go up. And being ready isn't really optional. It's mission critical at that point. So with a system like Readiness in place, your hospital doesn't just get by during these critical moments. You really shine. You respond to those clarification requests with confidence. You can show up to your on-site verification already prepared, with your document clean, accessible, everything's in one place. So this really isn't just about checking boxes. It's about showing your higher standards without the stress, without the fire drills, and without second guessing your data. When that verification day comes, we don't want you to scramble. We want you to stand tall and organized and confident and ready to prove the patient safety excellence you've really achieved throughout the year and have been sustaining. And with that, we have our second poll question. We'd love for you to participate. What are the primary challenges and collecting evidence to support survey answers using a paper or manual version of the annual Leapfrog Hospital Survey Binder. And we'll let you select more than one. Okay. Nice. Thank you so much for voting. Nice mixed bag here. Again, thanks for weighing in on that last one. I was really curious. And let's dive into your top challenges and talk solutions on those. So whether it's lack of time, which a lot of you noted, or competing priorities, or maybe having too few hands on deck, these are more than just minor roadblocks, and they tend to feel like real daily pressures that kind of ripple across the org. We see this all the time: not enough hours to prepare the binder, difficulty managing documentation year over year, constant juggling of multiple responsibilities or multiple hats. And let's not forget how manual the process still is, kind of cutting into the time you could be spending on actual quality improvement work. But the good news is all of these challenges are pretty solvable. And when you shift from manual binders to kind of streamlined digital systems like this, those hours that you used to spend chasing down documents or reinventing last year's work, you get those hours back. So you're not digging through folders. There's no more guesswork. There's no more late night scrambling. And automated platforms help to ensure that that evidence is centralized, easy to update year over year. I'm sure Michelle will get to that, but kind of syncing to last year's data as needed or documentation, just to make that process a little bit more seamless and easy. Helping your team to collaborate without chaos, assigning them tasks, assigning them roles to help prepare that data and get the information you need. And your hospital that can really stay focused on delivering that safe, high quality care and not really focus as much on the paperwork. So yes, every item on this list is definitely a challenge, and thank you for your answers and validating that. But together, they also really point to that clear opportunity that when we modernize processes, we get to reclaim our time and really let your hospital lead with confidence. And with that said, I'd love to pass it back to you, Michelle.
All right, thank you, Leah. So I'm excited to show you how this works inside our Readiness. And as I mentioned earlier, Vastian has one quality management solution, but it's actually comprised of 6 applications. In today's demonstration, we're going to be focusing heavily on Readiness because that is where we are able to automate and digitize the Leapfrog Hospital Survey Binder. But evidence can actually be connected from any of our applications directly in. So let me show you how that works. Okay, so now we're inside the Vastian quality management solution, and I've landed on my specific homepage, which is going to be set up for me personally based on my site administrator access or whatever access permissions I'm granted as a leader or frontline employee at my facility. It's very easy to use the menu on the left side of the platform to be able to slide down and select the Readiness application by clicking the arrow to open the application. And again, this is the application where you can electronically manage your Leapfrog Hospital Survey Binder. And as I mentioned, if you have evidence to support the answers to your Leapfrog Hospital Survey, you would be able to connect them rapidly from our other applications, such as Apple, where you can do your action planning and performance improvement monitoring, competencies, policy management within document control, and all of that can be connected directly into Readiness. So once you're in Readiness, you would actually select into the Survey Center, and that is the part of Readiness where you are able to, by regulatory standard or Leapfrog Hospital Survey question, be able to upload or connect evidence for your binder and or accreditation or certification standards. It also allows you to be able to upload or connect any required or requested documents. We know that some of the regulatory agencies have a list of documents that they want you to pull together either just ahead of your on-site survey or within hours of them coming on site, and you would be able to, again, be able to connect or upload them directly into the survey center to have them rapidly available. We also have an integrated and automated communication center that resides within our Readiness application. That allows you to stay connected to your frontline team members and your leadership team during on-site regulatory or verification surveys. You'd be able to send messages out to the entire workforce, individuals, or groups of individuals, and be able to respond back or have them respond back. And those messages can go out via email or text. So if you are selected for on-site verification and you needed to let your workforce know that the third party has arrived at your door, you would be able to do that. If you needed to let your medical staff office leader know that the surveyor wants to speak with him or her about the verification that your critical care intensivist are board certified and that she needs to come up and walk them through their credentials, you would be able to communicate directly within the system. So no more managing text groups or anything outside the system. We do that all for you. And again, the home and to-do pages, whether it's the overall home or to-do page or the home or to-do page inside each of the applications, it gives you a very quick view into the tasks and assignments that you are specifically assigned. So when you first go to electronically manage your annual Leapfrog Hospital Survey Binder, we will ask you to, whoever that person is responsible for completion or facilitates that process at your facility, we will ask that they go in and read the following disclaimer and attest that they have done so. And basically what this stipulates is that you as your facility leader and responsible person for completion of the Leapfrog Hospital Survey and the collection of your binder materials, that you still retain responsibility for that and making sure that what you've gathered and what you've submitted is both complete and accurate, and that, in your opinion, satisfies Leapfrog's criteria. And of course, that verification process and any data verification resides between you and Leapfrog, that we just assist you in integrating and automating that process. It also then will allow you to select the hospital survey binder and open it up within Readiness. And it will also allow you to either hide specific questions or sections of the survey binder that may not pertain to your facility. So, for example, let's say you do not have a pediatric ICU, so that you're not going to have to gather evidence for Section 5B. You might want to continue to answer, obviously, question 1, which is your time frame, and number 2, do you operate a pediatric ICU or not? But you won't have to answer the remaining questions because you don't have one. Within the survey settings, you would be able to turn off those questions so you wouldn't have to see them when you're actually working through and collecting your evidence. So again, you're able to turn off and turn on any question or any section of the binder as it pertains to the scope and services to your facility. Once you're inside the binder and working to collect your evidence, it allows you to track that progress in real time. The survey sections and the questions within those sections will be visible to you, and a very quick toolbar on the left side of that screen will be able to show you in progress. So basically, any of the sections that you're continuing to work on and gathering and collecting your resources and evidence would show in a yellow status, but any sections that you've completed because you've answered and also collected your evidence for the questions within that section would turn green. So very quickly, your leaders, your executives, and you yourself as the person facilitating the process would be able to know what is your progress in completing this year's hospital survey binder. So for example, looking at section 1B on billing ethics, to be able to see that that section this past year, in this current year's survey, had 3 questions tied to it. And since I successfully answered and completed my evidence collection for all 3 questions, my bullets are all green, my bubbles, and it actually shows the number of documents that I attached or connected to, again, show how I was able to answer the question in the manner that I did so. And because I successfully completed all 3 questions, it's giving me the overall green circle for that section. We also have the ability to hover over any particular question, and it will give you just a little insight into what that question is so that you know you're on the right one. So when you go to click and answer, open it to answer and connect or upload your evidence, you'll have it. So again, it's a large survey. There's many questions. So we also give you that hover feature so you'd be able to see specifically which question before you click directly into it. And collecting and gathering all of this information, remember that it will archive for you so that you'll have all of that evidence and those resources and those documents safely stored. And you'll be able to refer back to it at any time. Again, should you get asked for a data verification, you're selected for on-site verification, or just to refer back to when you're completing next year's survey and survey binder. So now I've actually opened up a survey question, and this happens to be survey question number 3 in section 1B, again from this year's survey and survey binder. And it's the question pertaining to whether or not your hospital takes legal action against patients for late payment or insufficient payment of their medical bill. We've also given the ability for you to record your responses here in the binder. Of course, you'll still have to record and submit your responses within Leapfrog's platform of the survey itself. But we've taken the allotted or allowable responses from the binder, and we've already made it easy by building those in for you. So you'd be able to use the drop-down arrows in the response section to be able to select this response for your particular facility. And we've also made it easy to connect or upload the required documentation for that specific question. So in this case, Leapfrog is asking you to gather or collect your policy or procedure document that clearly indicates when legal action is not taken. So in this situation, I have a policy here at the Vastian Hospital, which is Finance Policy 003, Legal Action for Late or Insufficient Payment of Medical Bills. And inside of it, it says we don't go after legal action, which is why I'm able to answer no to the question. And by clicking that arrow, I was able to very quickly connect my policy that I actually have residing in my document control application. And so there it was connected. The green dot shows, the policy shows there below. I'm able to click on it and actually view my current policy on legal action for late or insufficient medical bills. Now, because one person cannot be solely responsible for patient safety within your facility and facilitate or complete the entire survey and survey binder, it allows the quality or regulatory leader to be able to assign owners over specific questions. So for this question, I have myself, but it could very well be your patient billing leader. And you would be able to use the drop down as we interface with your human resources information system and be able to select the leader or owner over that question or process at your facility. You'd be able to select yourself as the approver, the person that makes sure that all of the evidence and resources that have been connected or uploaded you feel meet the intention of the Leapfrog question and the way that you are responding to that question. It allows you to communicate with those other owners and process owners of when you need that evidence uploaded or connected by. So it lets you set a due date. Calendar appears and you can scroll to pick the date you need it by. As you can see there, I left a little cushion before that initial July 30th submission deadline because I want to make sure everything's in and everything's correct and accurate. And then it allows the approver to be able to move that question through the different completion statuses. So it can be in progress initially, maybe in review as the approver is reviewing the documents that have been connected. And then once we verify that it meets the intention of our process and we feel meets and verifies the answer that we're providing in the survey, I can move that to a completed status, all within the system. And again, then that questions bubble will turn green. It will note the number of documents or evidence that's been attached, and it'll help me complete and move through the survey binder and sections. If you scroll down the page, it also gives the ability to add in some notes. So if there's just something you wanted to remind yourself, or you wanted to specify maybe a certain section of a policy or document and where the meat of that information, let's say, is contained, you can write and save notes in the notes editor. And And if there's additional or supplemental material that you need to add, in addition to the documents that the binder is requiring, we also left a section at the bottom where you're able to upload or connect other supporting evidence. There I just, again, connected the same policy, but you'd have the ability to connect or upload anything you need. Now, if you as the facilitator do not have immediate access to what it is that you need, you would have the ability to create a task, and I'll show that in more depth in just a moment. But you could, again, send basically a task assignment to that process owner, requesting them to complete that task, and then you would be able to, they would receive it in their to-do list, and they would know that they've been assigned a responsibility. And to the right of that, you can see right now it's not lit, but you can copy evidence from a previous set. So if you completed this year's binder, hospital survey binder in our readiness system, when you go to do next year's, it would be very easy to just copy over by click of a button last year's evidence into the current year's evidence. Again, your facilitator would still need to move through and approve. But for example, certain policies may not change year over year. If you review your policies biennially or triennially, it might be the same policy is still active and current. It would already be there because it would always show the most current and active version of that policy. But again, you may have to connect or upload new documents for the current year as your surgical volumes or maternity volumes and processes change. Now, looking specifically at how to create a task, again, it would allow you to use the drop-down arrows to select the person within your facility that you're assigning that task to. It would allow you to select the survey event, and in this case, it would be the current year's Leapfrog Hospital Survey Binder. And then you could write in exactly what you need or what that task is. So again, maybe I would reach out to that patient account leader and say, I need you to connect that policy, or maybe it's your women in services leader and you would need them to connect or upload their DVT prophylaxis results in their C-section mom population. You'd be able to give them a little bit of additional detail and again, set the due date. At the bottom, you would also be able to set a priority, stat, routine, how quickly do you need that information? And then it would allow you to upload any attachment. So for example, if you wanted to attach in the endnotes to the annual Leapfrog survey, just so they know exactly what you're looking for and how it has to be collected and making sure that you're pulling everything accurately into the letter of the survey requirements, you could send that to them as well, and they'd know exactly what you're looking for and what you're needing. Then you simply click on the Create Task button, and it's going to flow right into that person's to-do list. In addition to being ready and able to respond to category A and B for clarifications and be able to locate and retrieve your evidence, year over year, it would also allow you the ability to store safely any post-survey materials. So if you wanted to, in the post-survey section of Readiness, want to be able to maybe protect and keep a copy of the annual survey, you could. If you download your responses to the survey, I know the Leapfrog group always likes you to download, what you've submitted and keep a copy of your responses, especially before they update to the next year's survey. You would be able to do so. And as Leah mentioned, then they would be safely secured within Readiness and readily available. So if you do suffer any turnover in leadership, especially key leadership positions in your facility, they would still reside within the system, and the next leader would be able to go in and refer to them and grab them. I also mentioned, again, we have a very robust communication center, and that's in the bottom section. You can see the communication queue, where you'd be able to track any text messages or emails that you send within the system pertaining to any of your regulatory or Leapfrog survey binder work, and all of that would be ready to go. We also have a place for welcome packet information. So if you wanted to store, let's say, an opening presentation, a PowerPoint, you could download it and open it directly from. You might even want to attach a map of your hospital so that if the surveyors needed help in finding their way around or knowing, what units or what departments are on which floors, you could store welcome packet information within the system as well. So everything would be there and ready to go. And as I mentioned, the quality management solution overall has 5 additional applications that help you with your patient safety work. So again, you can develop and manage your policies, your standing operating procedures, maybe your safety data sheets, or even electronic downtime forms within the document control application. And any of those policies that you would need to pull into Readiness for your Leapfrog Hospital Survey Binder would be readily available and would be able to, at a click of the mouse, be able to move right into those specific questions within your binder. We also have an event or incident management application where you can report, investigate, and trend your patient safety concerns. We have Apple, which is action planning, performance improvement, and long-term effectiveness, where you can develop action plans and also monitor those key performance indicators, such as medication reconciliation, barcode medication administration, and again, some of your maternity care monitoring, like DVT prophylaxis and newborn bilirubin screening. All of that could be accomplished in Apple and then again readily connected into the Readiness application into your Leapfrog Hospital Survey Binder. The competency application allows you to create and push learning courses, read-in signs, and be able to evaluate the skills of your frontline team members using evaluation checklist and competency. So, for example, if you are needing to verify your employees hand washing physical demonstration when they onboard, you would be able to check that off with our automated competency checklist. And again, once you have those completed, you would be able to connect them directly into your Leapfrog Hospital Survey Binder. And lastly, our rounding application allows you to conduct regulatory rounds, environment of care rounds, infection prevention surveillance, nurse leader rounds like those leadership barcode administration direct observations, and patient experience rounds. So again, all of those applications complement each other and work to automate and digitize your quality assessment, performance improvement, and patient safety program. And a lot of that work coincides and ties with best practices, safety practices that you will need to respond to and attest to within your Leapfrog Hospital Survey and your Leapfrog Hospital Survey Binder. So with that, I am going to actually open up for questions. And Leah, I know you'll be assisting me to see if there were any in the chat. Again, we
Yes.
appreciate your interaction. So any questions that you have for us, please send them in.
Yes, thank you for that reminder. Folks, we're on Q&A. I'm going to read some of these to Michelle now, but feel free to keep entering those in the Q&A section at the bottom of your Zoom screen, and we'll be happy to get to those. Lots and lots of questions. One of the very first ones was asking about preparation for other survey types. For example, Joint Commission.
Okay,
can you tell us a little bit about that?
Yes, so readiness can also be used for that purpose as well. That's actually it's one of its primary purposes. So yes, if you're following either CMS conditions of participation or the Joint Commission standards and elements of performance, DNV, ACHC, we do have those standards readily available in readiness. So very similarly to your annual Leapfrog Hospital Survey Binder, you would just be able to select those and those standards would appear. And in similar fashion, you would be able to assign ownership over those processes or over those standards. And in a very similar fashion, maybe your regulatory leader might be the approver in that case, but you would be able to set due dates. And again, you would be able to connect or upload any evidence to support your hospital's compliance with those regulatory standards. And again, that would be more toward the bottom of the page, where in the Leapfrog binder, it would be more of your supplemental additional information, because obviously in the survey binder, Leapfrog has defined specific documents or elements that they're looking for, whereas in the regulatory standards, you may have different ways of being able to meet that standard. So we give you that place at the bottom to be able to connect or upload. Yes. And you are able to execute and integrate multiple sets of standards at the same time. So could you be working on your Joint Commission regulatory readiness at the same time you're gathering your evidence for your annual Leapfrog Hospital Survey Binder? Yes, of course. You'd be able to just toggle between the two in a very easy drop down, work on the one and then close it, work on the other. So yes, great question. Thank you.
Right along that line, Michelle, when we're talking about managing multiple facilities, I know we probably didn't show our drop down where we have just a single login, one point of access, but we're able to flip between facilities. So we would be hosting the standards for each of those, and it is easy to toggle those as well. So no, thank goodness, no separate logins needed for that.
Right, right. So obviously we can assist, large healthcare systems that maybe have multiple sites within it. And you would very quickly would be able to, at the top, select the specific hospital or facility in that health system and manage from there. So, because as we know, for Leapfrog Hospital Survey purposes, each hospital has to do their own, even if you belong to a larger health system. But yes, and again, but depending on access permissions, someone at a corporate level might be able to toggle to each and any of the facilities to see progress. But the leaders at the specific facility would be able to see their binder specifically. So yes, it can certainly manage multiple binders for multiple hospitals within a larger health system, of course. Yes.
Thank you, Michelle. Perfect. So many great questions. I'm loving these. One question was, which I had answered, both are perfectly acceptable, but do folks use the digital binder during a site verification, or do they still print the content? I had answered that both are perfectly acceptable. If surveyor's okay looking on a screen, that's great. If they want it printed, that's also great. Did you want to chime in on anything additional there?
Yeah, I mean, we know that sometimes that can vary by whatever the regulatory, or if it's Leapfrog, or, it can vary. You may have some surveyors that are perfectly good with kind of, belling up to the computer with you and allowing you to drive through. And then there may be some that say, no, we want to do that on our own and we want you just to supply it. So, and like maybe a paper, whichever way, you'll have them readily available at your fingertips in the system. So if you do have a surveyor that's willing to, sit there with you and allow you to show them on the electronic screen, great. If not, you'd be able to click of a button and print those out if you needed to. So yes, either way, perfectly acceptable. We would make it easy either way.
Thank you. The next question, will Vastian have the latest version of the survey as they revise a few times?
Yes.
So yes, I've answered that, but you might want to explain the process of how that works.
Yes, so we do have a partnership with Leapfrog, and as they complete the revisions, and as those of you that are very familiar with this process, Leapfrog always sends out their and I'm knowing this just from my experience as a hospital quality leader, but they will send out those proposed changes. I know they usually give a time for a public feedback, and then they make those determinations. They send out so yes, as they publish new versions of the survey binder each year, we will of course have that and update. We will have what they have. So as soon as they give us the new version of the binder, we will have that ready and available to our clients in readiness. Yes.
Thank you for that, Michelle. This next question I actually really love. And I'll tell you how I answered, and you can chime in and see if you'd like to add some more color to that. But do you have data regarding the time needed to enter the data into the app initially? And so what I usually hear from clients is that 40% reduction of effort and time efficiency savings is pretty common for the first year. It still takes a little time as you're using it for the very first survey binder or accreditation survey, whichever it might be. But typically subsequent years tend to be even more efficient, as likely, some of those policy links are probably the same policy links you'd use for the next time. In our case, we keep those live through document changes, so the links wouldn't need to be refreshed. So for evidence that doesn't really change, that we're bringing forward, that's time savings. And then you're really just tackling the updates, keeping, the new really refreshed data in place for the next survey, addressing additional questions, et cetera. But
Yes.
I love that question.
Yes, exactly. And even in that first initial time that you complete the binder within Readiness, no more, I mean, definitely less time than you would putting it together manually. So, but yes, you would have to obviously go through and pick who the owner is over that question if you need, if it's like a department or specific owner. But yes, but definitely it would be even faster than if you would have had to do that on paper, and do that through, manual emails and chasing down that leader or tracking that binder down within your facility. So it's a time saver overall. But I agree with Leah that as you move forward and you're able to copy over evidence year over year, it would get even faster year over year. So, but again, you still have to make sure that whatever you've attached are connected, that you feel, meets the requirements and obviously meets the intention of how you've responded and answered that question. But no, Leah, you answered that perfectly. Now, keep in mind too, however long it takes, the survey is so big, but think about, your accreditation standards are large. You're talking hundreds of standards and you're talking about thousands of elements of performance, in particular, like with Joint Commission. So, but again, as you complete that, faster than you would do it manually with a spreadsheet, for sure. And again, once you have that initial set of evidence and documents and everything collected, how much easier. And I'm curious to, if you're doing that manually, how are you able to really show that you are compliant with what, about 1,600 or better elements of performance? That would be very challenging. Within Readiness, you're able to actually see in a graph. So when you initiate that survey, you would be able to see, like, here's the 50 documents that they wanted ahead of time. And you would know exactly where you're at with a dial. They wanted 50 and we've got 49 out of 50 loaded in green. Same thing with survey binder questions versus standards or elements of performance for a regulatory survey. You would know, looking in an instant, how ready are we? You would know by a green dial, a green line, where are we? How many of the questions did we answer? How many are we complete? And again, assuming for the survey that you're going to have them all complete because you are going to have to submit. So, but yeah, no, it's
Great, thank you.
easy to
Lots
see in
more
real time.
questions. We'll see how many we can pack in. I was hoping we might stay on the call an extra few minutes. Leapfrog folks, if that's okay, just to get to those last minute ones. But you had mentioned before linking QAPI monitors and attaching those as evidence. How does that work?
So, the Apple application allows you to basically monitor your key performance indicators in real time through basically QA monitors. Now, a lot of those we have developed already, but again, you may need to before, as you import those in, to your system specifically, you may want to make customizations or slight tweaks or changes to match how you do that element specifically at your facility. Or we teach you an implementation how to even create your own. But you would be able to obviously, if you're looking at, and tracing, I'm trying to think, strategies to prevent CLABSIs, let's say, or CAUTIs, to prevent hospital-acquired infection. You'd be able to basically perform those chart reviews or those direct observation tracers directly into the system, record your answers as you're completing that work, and each of those would be stored within Apple. Now, for connection purposes, you may want to actually connect an aggregate report. So Apple rounding events, they actually have cumulative or aggregated reports where you could show, like, for a period of time, you could pick. I know some questions and timeframes within the Leapfrog survey are like the last 3 months or last 90 days worth of information. Some could be annual, right? So you're able to pick those timeframes and then be able to attach or connect that report. Another great thing within that, we didn't kind of hone on it today here, but our reports all have graphs that come with them. So if you want to aggregate, let's say, your DVT prophylaxis results in your C-section moms, in addition to actually having the report itself, it would actually graph your results, and you could actually directly send those into a PowerPoint presentation within our system. So easy peasy. No longer have to build your own graphs at the end of a quarter or at the end of a performance period, and you wouldn't have to snip it into a PowerPoint. Our system does that all for you automatically. So again, making it easy.
Thank you for that. We received a couple questions about how the summary of responses look. So um, maybe one question involves, what if I wanted to answer for multiple facilities in a single question, or I have lots of different pieces of evidence that I want to collect? How will that look when you're viewing that question?
Okay. Well, if you're collecting, if you have lots of evidence, so let's say same facility question, but you have a lot of documents to connect. So again, in the binder, in the Leapfrog Hospital Survey Binder, Leapfrog has specifically asked, has specified what they're looking for, right? So we gave you spaces to be able to connect right there. But again, if you have additional or supplemental material that you want to have ready to go, then we had that section down at the bottom. So you'd be able to connect or upload as many documents as you need in that section. So up at the top section that was appearing right under the response, it's kind of, we have a space for each document that Leapfrog specified they were looking for, or resource, whatever it is. But we gave you that space down at the bottom to be able to connect or upload anything else you need. So if you needed to put 10 more things in there, you could. You could upload or connect 10 more documents. Now, as far as being able to answer for multiple facilities, for the Leapfrog Hospital Survey Binder, it is facility specific. So because each hospital has to submit their own survey, and each facility is supposed to be collecting their own survey binder. So now if you're in a health system though, you would be able to toggle at the top from one facility to another and go into that facility's binder and be able to answer in each of them, but you wouldn't be able to answer for multiple facilities in one question. You'd have to go into the binder of each of those facilities and answer it there.
Thank you.
Mhm.
I was busy trying to type some answers while you were explaining.
Now, if I can expand further though, but let's say you have a corporate policy that states that you don't go after the patients for later insufficient payment. And that's the same policy for all 10 of your hospitals. And you've shared that policy with all 10 of your facilities. So then each of them would be able to link the same policy in their automated binder. So you can share resources when it's feasible to do so. Again, as long as that is the resource for that specific facility, right? So as long as that facility is using that resource, then that's fine.
Many of the questions we're seeing too are kind of digging into parts of the app and menus that we didn't quite have time to look at today here, since we were just doing a broad overview. Can you let them know about hosting, private demonstrations, which we absolutely love to do, and reaching out to us to get those scheduled and we can dive in together?
Oh, of course. So on the screen right now, you'll see mine and Leah's contact information. I would say go ahead and use mine. So you can certainly reach out to me at michelle@vastian.com. Additionally, the Leapfrog PAC leaders will be sending you, as they do after every PAC webinar, they'll be sending you more information and a supplemental material that we're providing, and my contact information will also be in that. So yes, of course, we would love to demonstrate readiness more in depth for you, or any of our applications, all of our applications. So if you would like to see more, and if you're interested, yes, please do so. Please reach out to us and we'd be happy to do a deeper dive and show you more of the system's capabilities.
Thank you. Another great question, and I feel like this is always really helpful to understand. But when tasks are assigned, does the person assigned get an email, or do they have to log into the system to get notified of the task?
Oh, that's a perfect question. And you know what? I probably didn't answer that fully during the presentation. So thank you for calling that out. Both. So they will get it to flow automatically into their to-do list, but they will also get an email. When you set up your system initially during implementation, you as a leadership team, quality leader, you can decide who gets emails and the frequency with which they get them. So you can set it up that says, okay, as soon as I give an assignment, the email hits. You could say, when I make an assignment, let's put an hour delay on that, and then they'll get it. But yes, no, and you can also decide how frequently you want them tagged. So if you want like a follow-up email. So yes, no, you actually get to drive that. The leaders of your system would get to drive that in the initial setup and implementation, and they can change it at any time as well. But no, you get to decide. But yes, no, they would both. They would get an email, and they would also have it on their to-do list. So yeah.
It's worth saying too that most of the time we're setting up with single sign-on.
Mhm.
So this is really easy. They will automatically authenticate using SSO, which you probably already have set up for some of your other systems. So they'll get those emails, they'll click on the link, it authenticates them in. So it's really, really simple. And yeah, notifications are custom, but we do tend to send those every 3 days as our default, as a reminder, so folks don't forget. Lots of questions on pricing. Michelle, I did answer those, just that, depends on it. We price by facility and size, and that we can chat about that. But maybe we just point out on the screen again for pricing questions. We're super happy to follow up with you about that.
Yeah, just contact us offline, and we can provide you that information.
Wonderful. And I think we only have 2 minutes left. So
Yes. Well, Leah, are there any time sensitive or critical questions you want me to answer one more, or are we?
I think we got through most of those.
Okay, great. Well, I am just, thank
Yeah.
you so much for your interaction today, attendees. With the polling questions and the amount of questions that you entered into the chat, we're just delighted. We appreciate your engagement and providing us the opportunity to demonstrate for you how Readiness and Vastian can automate and integrate and digitize your Leapfrog Hospital Survey Binder. And I wanted to give a big shout out and thank you to Leapfrog. We are just thrilled to be members of the Partners Advisory Committee. Being able to work and drive patient safety in multiple ways as a PAC team member. So thank you, Leapfrog, and thank you, attendees, for joining today. And we look forward to talking with some of you afterward. So thank you.